So there's two primary causes of neutropenia, and one of them has to do with inflammation, but it's not simple inflammation. It is what we call severe or overwhelming inflammation, where your tissue need for neutrophils overwhelms the amount that your body actually has in storage and is able to make. And then the second is a decrease in production of neutrophils, and this can be due to a variety of causes within the bone marrow. So first we'll talk about inflammatory neutropenia. So in neutropenia caused by overwhelming inflammation, in this case the tissue need or demand for neutrophils exceeds the number of neutrophils that are available in the marrow. So that means that the storage pool of neutrophils in the marrow leaves the marrow, goes to the blood, and then goes into the actual tissue. And the marrow either doesn't have time to keep up, or as quickly as the neutrophils are made, they're going to the tissue. And so this is, again, overwhelming inflammation, and it tends to be bad, meaning it has a poorer prognosis than just regular old inflammation, or like what we typically think of as an inflammatory leukogram, neutrophilia plus a left shift. And I have dog, a cat, and a horse images. If you can't tell, they're, well, pictures, not so much images. And I don't have a ruminant because in ruminants it's different. And so what kind of things could cause this? In horses, definitely their GI tract. They can get severe GI tract inflammation from things like salmonella, distal colitis, even potomac horse fever, causing overwhelming tissue inflammation. Certainly any sort of gut rupture would cause overwhelming tissue inflammation. In dogs, I've seen it in aspiration pneumonia, and in various other inflammatory processes. In cats, it's a little bit less common. So in all of these, tissue use is going to be greater than bone marrow production. And you can also have, if you have it with a left shift, that equals, again, a degenerative left shift, and that's a poorer prognosis. You can also have toxic change, and not necessarily, right? So you're not always going to have these as well. If you have a lymphopenia, then that equals concurrent stress leukogram. If there's sepsis, you can have hypoglycemia, but that's not like characteristic necessarily of inflammation and neutropenia. So the other thing to realize is that, remember, it's going to take days for the marrow to respond. So the animal can potentially succumb to the infection potentially prior to the marrow responding, or if the animal's able to respond and get the inflammation under control, you should start seeing a neutrophilia within at least 3 to 4 days. If it doesn't start increasing within a few days, then that's not a good sign. Decreases of marrow production of neutrophils by itself, just seeing a decrease in neutrophils without other lines affected, at least in the marrow, is kind of uncommon. So we don't typically think of just decreased neutrophil production without any other lineage being impacted, at least in the marrow. That said, of course, remember that neutrophils have the shortest lifespan in blood, and that's 10 to 12 hours. Meaning when the marrow is affected, you're going to see neutrophils decrease first, platelets next, and then red cells after. So marrow diseases may start with a neutropenia. Things that support decreased production are going to be decreases in other lineages. So you can see a thrombocytopenia and you can see an anemia, but of course it depends on what else is going on within the patient. Is there bleeding that's accelerating the anemia? Is there consumption of platelets? So that really depends. Atypical cells in circulation, so things like to support leukemia or infiltration of the marrow with lymphoma, those would support potentially a cause for the neutropenia with infiltration of some sort of neoplasia. And then certain infectious agents in the actual blood may be things that support your cause of the neutropenia. So that's blood work findings. In general, though, we have to just talk about causes of potentially decreased production of neutrophils. So I'm not going to go through all of these. I kind of just want to talk about a few classics. So there's viruses that have a tropism for rapidly dividing cells in the lymphoid system, bone marrow, and these most often are parvoviruses, and this includes parvovirus in dogs and panleukopenia, which is a parvovirus in cats. And so you really want to know the age of the animal and the vaccine history, because a lack of vaccine history, a young animal, more likely to have potentially a parvovirus. You also want to know what drugs the animal has received. Certainly chemotherapeutic drugs are commonly going to cause neutropenia, but then you can have idiosyncratic reactions with things like phenylbutazone or phenobarbital. Treatment with estrogen, and that's obviously a drug, although it could be endogenous as well from a Sertoli cell tumor or persistent estrus in ferrets, can cause bone marrow suppression where you see neutropenia first. And then you can have bone marrow disease from things like neoplasia or maybe fibrosis or necrosis can even do it, and certain infectious agents can also cause bone marrow disease leading to neutropenia. So if there's not these other changes within the blood, you're going to have to look at potentially other ways to figure out why the animal is neutropenic. Again, that's going to include things like your vaccine history, your age, is there concurrent diarrhea to support parvovirus or exposure, what drugs has the animal been getting into potentially or been given, and then you may have to do a bone marrow examination to figure out why there is a neutropenia. The last cause of neutropenia, sequestration, is related to endotoxemia, and that can happen concurrently with inflammatory types of neutropenia, and I'm not going to go into it.